This patient looks at me with the calmest voice and these big ass eyes and goes, "Tell my wife and my daughter that I love them." In that instant, he coded. And I just yell out as if it was a part of fucking the pit, "No!" and jump on top of him and start CPR. One of our good friends looks at me and goes, what the fuck is wrong with you?
Grab a coffee.
Take a breath.
You've just clocked into the ER edit.
I'm Caitlin.
I'm Carly.
You are now clocked in. And we're back.
Episode 10.
How?
Double digits, baby.
Are you guys loving this as much as we are? Because I think this is what we should have been doing for a long time.
I know.
Because
I
it's been
think
really
this is
fun.
my calling. Don't tell me if it's not.
Please do not put that in the comments at all. But I do think that the feedback's been really good.
I know. It's been so much fun. I love seeing, I read every single Spotify comment.
Every single one.
And I try to respond. And it's just so fun. Like when people post on their Instagram stories and they tag the ER edit.
Yep.
It's so fun seeing like, oh my gosh, real people are listening to this.
Well, and it's like when you guys tag it and like show our little like thumbnail coming up in your cars when you're watching it, there's like a part of me that kind of wells up a little bit.
Every
because
time.
I can't believe that this like actually happened, but also that you guys have been liking it.
Yeah.
And just so you know, Carly is the one that's behind all of the Spotify comments. I'm the one on YouTube. So it's like we are literally behind the scenes. We have Mike, who's our literal angel
Mike is
of an editor.
Mike really is the backbone of this podcast.
Truly. He's coming everywhere with us because our goal is to reach the top. But we have, something exciting that I do want to share a little bit is we had no idea before we started this that there was like a top 200 on Apple, right?
Yes.
Okay. We have hit under 100, like the top 100 one time. And then this like past like week and a half, 2 weeks, I want to say, we consistently stayed in the top 200. And Carly and I are freaking out because like, that was a big deal.
That's a big deal for this little like podcast in our room that we started. And it's not all about like being the best, but I think what's crazy is this is something we were so excited to start. And anytime you start something new, you're kind of like, are people going to like this? Are people going to want to follow along? And we're just so thankful that you guys are listening, that you're enjoying it, that you're giving good feedback, and that it's doing as well as it's been doing. So we're excited to keep going.
Well, and it's like resonated with you guys, which is all we could have hoped for, because I think the reason why we started this at the end of the day was because I kind of wish I had something like this to listen to when I was like through all of these different stages.
Yeah.
But there hasn't really been like a nursing podcast. Some of them are fantastic.
Yeah.
But there hasn't been one that I feel like is like very raw and like very authentic. And I think that that's what we're trying to bring. So when you guys share those comments with us, like, this is what we needed, I'm just like, okay, we're doing it.
Yeah. It makes us so happy. We're happy to be doing this. It's
but we have another very good one today.
Another thread. You know, we love our threads.
We love a thread. This one's from TikTok, and we're just going to dive right into it. We'll try and explain because these ones are like, well, I'll just read it. It says, tell me the craziest lab or vital sign you've seen as a nurse. So we're going to go through like, there used to be a board in our break room where we would write down, like, do you remember that?
Yeah.
There was like the craziest values that you would see for the week.
like the highest or the lowest.
Yeah. So this is
you
kind
could
of
ever break it, like break the record.
Yes. So we're going to read this thread and then we'll kind of explain to you. Also, some of these, I have read a couple and I'm like, is that real?
Oh, really?
You know what I mean?
I haven't read any of them yet.
Well, this one I'll start off with.
Okay.
It says the BP was 27/12, temp 89.8, and glucose was 19. The patient was alert and oriented.
No way in hell.
They were not.
27/19.
I've never seen a blood pressure that low register on the monitor.
I've never either. Like, it's over palp because it's so
low.
low. I don't think I've ever seen 27 systolic.
Never. Over 12?
Was this an automatic blood pressure taking like the airs?
Well, I'm
blood
like,
pressure?
how? This is all wrong. It's all wrong. So, yes, your temp can get that low. FYI.
What was the temp?
89.8, which we've seen.
Sure.
I've seen lower than that
believe
before.
that.
Yeah. That's believable. A glucose of 19, even believable.
Yeah.
The blood pressure for me is what's really
The
doing.
blood pressure is what throws up a little bit of a red
What's
flag.
the lowest blood pressure you've seen? Like register on the monitor.
Oh, man. I don't know if I remember.
I think
Probably in the 30s.
Okay,
40s.
that's like lower. I was going to say probably like a 40s has
40s.
registered, but that patient was not alert.
No.
Yeah. Okay.
Heck no. And no diastolic.
No.
A white blood cell count of 498,000.
What?
So white blood cell count is elevated when there's usually an infection going on or like something stressful in the body. Can cause like a bump in a white count. Normal for reference is what?
Making me really think about these values. Okay, well,
I think it's like 12,000.
it's still considered normal, right?
Maybe it's 11,000. Yeah.
So
So
like I was going to say, I have seen someone with like, obviously you see white counts that are very high, but like even a white count of 20,000, you're sick.
Yeah. And I've seen people septic that are like 20,000,
Yes.
21,000. So 498,000, like what is actually going on?
I would love to know, like, what was the diagnosis there? Because
Are you necrotic, like from the inside out?
they had to be. They had to be like literally dying on the inside. Is that compatible with life? I don't think so.
Yeah, that's crazy.
Someone says a BP of 30 over Jesus. That seems more believable to me. Okay, this one has a lot on here.
Oh boy.
Hemoglobin of 2.3, lactic of 24, troponin 124,000, glucose of 11, pH of 6.6, sodium of 216, K was 13,
No.
ethanol 676. Should we break all these down or just the highlights?
Were they
No, I'm saying like, should I?
Were they alive?
There's no chance. So just so you guys know, alcohol levels in the hospital are done by the hundreds, essentially. So they're not done on a point system like you would blow
Like
for
on
a
a
cop.
breathalyzer.
Yeah. So an alcohol level of 676 is essentially a 0.67 alcohol level.
Which is very high. 0.67.
Right. So we're talking about legal limit being like what, less than 0.08?
Oh, wait.
Yeah. So just so you guys, for like reference, that's what we kind of relate it to in the hospital is like, we'll take the hundreds and then make it into our own decimal with it to see. That's not compatible with life, but some people's alcohol levels can get
What's the highest alcohol level you've seen?
probably somewhere in the 600s.
Really?
Yeah.
I've seen, I think, high 4s, maybe low 5s, and was like shocked that they were alive.
This patient was intubated.
Right. Like they weren't awake and
No.
alert.
I mean, how can you be?
No.
But also a sodium of 216. We need to talk about
So
that.
that's concerning.
Oh my gosh. So your normal reference for your sodium is 135 to 145. And sodium is one of those electrolytes that really doesn't take much of a variation to be symptomatic.
And it can cause a lot of neurological defects.
A ton.
Like seizures, a ton of issues.
So sometimes we can see patients that come in.
Like even in the 120s.
Yeah.
Can
And they're
cause
very
a lot of
confused.
Issues. So now 216.
That's the highest I've ever seen in my
not
whole
good.
I've never heard of anything like that.
Also about that troponin, I want to like touch back on that real quick.
Oh, yeah.
Where was that? Okay, a troponin of 124,000. Okay,
That's
so I have a little
insane.
story here. When I was a newer nurse, I was like probably 3-4 years into my career. I worked on a step down cardiac, so it was like post open heart, post cath lab patients, etc. This is where I learned about calling cardiologists. I got taught a lesson early on and I felt so stupid. So I just want to share this with anybody out there who may not know. I was working night shift and I had a patient who, morning labs are like 3-4 a.m. So the troponin came back and it was like, I don't even remember the actual value, but it was like super high.
Okay.
Like crazy high.
And your butthole puckered.
And I was
you're
like,
oh shit.
my gosh, they're having a cardiac event. So I call cardiology on call in the middle of the night, like 2, 3, 4 a.m. And I'm like, I'm calling to let you know that the patient's like troponin came back critical at this level. Did I go back and like trend them? No. Mistake number one.
We were concerned right off the bat.
I was just like, that's the craziest, highest troponin I've ever freaking seen in my life.
I'm going to run and be the hero.
Yeah. Like, let me call him and let him know. Let me save the day.
He's going to thank me.
Luckily, he was a nice cardiologist. And he was like, yeah, we went in there today and we put a stent. So we were messing around with the heart. And anytime you do that, like your troponin's going to shoot up after you place the stent because you've irritated all of that. And he's like, that's actually lower than the one that we drew last night. It's going in the right direction.
Did you say yeah?
Oh, damn. when you say it like that.
I know. I just wanted you to know that I saw it. Thank you so much. Have a great night's sleep.
About wanting to crawl into the concrete floor.
I don't know how in those moments, like as a new nurse like that, because 3-4 years in, you still don't know really anything. You know what I mean? Like that you're starting to get your
I was
feet.
new to this unit. And so I was new to like
these doctors,
these procedures. And so it's not like I didn't have nursing experience. It's like,
no. But when you see critical values like that, your brain is trained to be like, respond. You know what I mean? And so you do. And then you're like, oh yeah.
Well,
I knew
people
all
talk
of that.
about critical thinking. And listen, I just have to say this. I'm just on one today. So I posted a video about the freaking nursing diagnosis in nursing schools and how we need to be done with them. And there was a handful of people that were like, this is how you learn critical thinking skills. No, bitch, it's not.
It's not at all.
So these situations where I still was like, working
how are you going to learn anything critical off of a piece of fucking paper?
No. And people say, well, it teaches you diagnosis and da-da-da. Like, I don't know. Like maybe, but I'm 3-4 years into being a nurse and I'm still working on critical thinking because I see this lab value. I'm like, I mean, this is all lived experiences that teach you like, okay, so now do you think every time I got a critical troponin, did they get a stent? Did they have a procedure? Let me go look. Is it trending in the right direction? So yes, per policy, you still have to let the doctor know that there's a critical value. What I do now, or my practice now, is saying, hey, FYI, their troponin came back this. It's less than their previous one. Just letting you know.
Yep. But these are all lived-in experiences, I think, is the main takeaway.
And a nursing diagnosis did not teach me that.
Ever. And it's not going to. I mean, most of the biggest mistakes that I've made, you better believe are the first things that I teach people that like I precept.
Absolutely.
Because you would have never known unless you've done it.
Yeah. And you have to learn. Like you have to learn.
But that's boots on the ground.
Mm-hmm. This one's kind of weird.
Okay, I'm ready.
Blood sugar of 2020.
Wow.
Right after midnight on January 1st, 2020, patient awake and talking.
What?
I have had a glucose of like 1300 on somebody that was like alert and oriented. And I'm like, that's high.
Really?
Do you feel weird?
Did they feel weird?
I don't know. I don't remember, to be honest.
You know, it's patients like that, though, that can get that high that have felt that before, I feel like.
Like they know.
Mm-hmm.
Actually, no, they could tell. They're a type 1 diabetic.
Oh, so we've been here
with
before.
This their whole life, but they know. They're very in tune with their body.
So I like a DKA patient because for the most part, they're pretty easy, right? You're giving them. So let me explain to the class. DKA is diabetic ketoacidosis. It typically happens, I would say, more commonly in type 1s. It can happen in type 2 diabetics, but I think it's more common in type 1s. So sometimes you can see this. This is typically how children find out that they have diabetes, as they normally will go into this. It causes a very specific type of breathing. Your breath will smell very fruity. Do you have that?
What?
Nose where you can
smell
Can
it?
you smell ketones? Okay. So all of these things kind of happen with these patients. However, it can be really, I mean, DKA can kill you at the end of the day. You can die from it.
Definitely.
But there's like early intervention with it in our scenario and kind of in every hospital setting. These patients will become ICU patients because you're monitoring their sugars every hour, which is very, like, it's a busy patient. Mm-hmm. You're titrating insulin on them, all while giving them a little bit of sugar through their IV, because if you mess up and give them too much insulin and not enough sugar at the same time and balance it out. I'm trying to explain this in like, does this make sense what I'm saying?
Yeah. Well, yeah, I think are you trying to explain closing the gap?
The shift. Yeah.
Yeah. So they have what's it called, an anion gap. And it's like, you want to close it or make that number go down. But if you do that too quickly,
you can cause brain swelling.
Yeah. So you have to do it very slow.
So it's a process with these patients, but you have to be careful because these patients, like when you see these glucoses like this and like all of these numbers, these patients can sneak up on you and actually get very, very sick. But they can also look at you and be totally fine and you would have no idea that their sugar is 1300. Mm-hmm. You know what I mean?
Yeah.
This says that someone's hemoglobin dropped from 11.8 to 1.9 in less than 30 minutes. So where are we bleeding from?
Okay.
Where are we bleeding from, my
So what's
friend?
the first thing you check when you see that?
Someone said, did you find the leak? This to me,
If there's no obvious blood, like coming, what is it called? Occult blood, like where it's like coming out of their body, where is the first place you're going to look?
oh, well, we're doing a fast exam with the ultrasound. Is that what you're saying?
Yeah.
Yeah, inside. You got to look inside.
The
This is like
belly,
one of the main.
flank.
Yeah.
Those are big areas where a lot of blood can pool and it might not be very obvious at first.
Do you know what people probably don't realize bleeds a ton? The spleen.
Mm-hmm. Well, that's why like spleen lacs
Big
go
deal.
to the ICU.
Oh, they go to the OR sometimes.
Yeah.
Take that baby right on out.
Yeah.
Okay, this is a crazy story regarding this. A teacher from Indy's school, okay, he lives up in the sticks and was playing softball. Old man, beer league softball, okay? He dove in to third base, got back up, but all of a sudden was like, something feels wrong. Something feels really wrong. All the kids were telling us like he's been missing from school for so long, all of this stuff. We didn't know what happened. Turns out when he slid into third base, he ruptured his spleen. Ruptured his spleen. Because he lives in the sticks and he was in this like beer league, his buddies drove him to the nearest hospital, which is not a trauma center. I talked to him about this later at the back to school barbecue that we like all go to and stuff. And I was like, hey, are you feeling better? And he was like, wait, you work in trauma, don't you? And I was like, I do. And he was like, that was the craziest thing I've ever been through in my whole life. So he laid it all out for me. And I was like, what's the last thing you remember? They ended up not being able to transfer him because he was too unstable. So they had a surgeon come up to the hospital that he was at and do surgery there to remove his entire spleen. And he said the last thing he remembers was that they were calling out he was like, I saw lots of lights and they were calling blood pressure 60 over something. And he was like, and I don't remember anything past that. And so I looked at him and I was like, you damn near died, my friend. But it was his spleen.
Whoa.
Isn't that wild?
Lesson here. Don't do any physical sports when you're over like 40.
No, you can't take it.
No, your body is not going to ever feel the same again. ETOH of 740.
Can we get more context or were they awake?
There's 4 replies. Let me see. Those are rookie numbers. Got to pump them up.
Rookie numbers.
740 is the highest I've ever heard in my life.
I've never. And also, okay, more context with this. Who scares you most? An ETOH patient? Oh, like a legit detox ETOH patient? Those scare me.
Yeah. But like when you say legit detox, it is not the patient who came in and just had a 740. It's a patient whose actual alcohol is 0. They're daily drinkers and they haven't had a drink in 3 days.
Yep.
That is what makes me nervous.
When they tell you that in triage and they are visibly diaphoretic, they have tremors like you wouldn't believe, they are nauseated and hallucinating, they get a recess room.
People whose blood alcohol is high or who are daily drinkers, they're not going to go through withdrawal symptoms until that is down, to 0. Yeah, that's a high number. I don't feel like at 740 somebody should be awake and talking. But I'm talking about people who like live in like the 300s.
Yeah, and that's a real thing.
But the detox symptoms, seizures, like people can die.
Oh, yes.
And it can be very violent. It can be very, very like hard to watch. So when somebody comes in and they're sweating, they don't look good. They say, I drink every day. I haven't drank in, a few days and their blood alcohol comes back at 0.
You better be running for that crash cart.
Yeah.
You're tubing that patient too, because these patients do have seizures, but they a lot of the time go into what we call status and they don't stop seizing.
That's so scary.
And it's really scary to watch. They also, alcoholics, like raging alcoholics we're talking about, have something called varices. And they will literally bleed out right in front of you. And it's the most like you are literally in a scene of a horror movie.
It's like fountains of blood like coming out.
And you're just watching them die because there's really nothing you can do. Oh, they scare me.
Scary.
Oh, we haven't touched on this yet. A CK of greater than 40,000.
So that's a rhabdo patient.
Yeah.
It has to be.
Yep. So what does it stand for? Creatinine kindness or something like that?
Creatine, I was going to say. Creatinine kinase.
I could spell it for you right now. I just might not be able to say it. We just say CK. This has actually been going around a lot. I don't know if you do you follow Beach Gem, the pediatric ER doc on TikTok? Have you ever heard of her? I really like her. But she tells like some crazy stories. And you know, there was that flu going around where
Like recently?
where the kids like weren't being able to walk.
Oh.
So they were basically essentially going into rhabdo. They had like a different name for it for these kids, but they were getting the flu and then having symptoms a couple days later of leg pain, not being able to walk, all of this stuff. And that is what rhabdo feels like. A lot of the time, rhabdo is when you do like a super hard workout. We see it a lot with like cyclists that just do a huge marathon.
A lot
or
of CrossFitters too.
CrossFit, totally. And it's like a classic like telltale. You know exactly when they come in, they're having horrible leg cramps, like the worst you've ever felt. And their urine is going to be like a Coke colored or a tea colored.
Very dark.
Yeah. And you can immediately be like,
but it's not just concentrated urine. It's like that specific amber
it is
color.
A very specific color. Yeah. And so how you fix a CK that high or rhabdo is just a shit ton of fluids. So these patients will get admitted. You will bolus them.
A lot of times they will have to go to ICU too because they have to get a lot of lab draws, close monitoring.
Yeah, they can get really sick. They can get really, really sick. But these patients, you just load them up with a ton of fluids and monitor them. But it was happening with kids with the flu, which is kind of scary.
That's very interesting because what it is, correct me if I'm wrong, but it's like you do a really hard workout and you know when you lift whatever, you get these like tiny rips in your muscles, right? That releases the lactate or the lactic acid. And is it like a buildup of that?
Yeah, it's a buildup of it that just kind of spills out essentially.
Yeah.
It's crazy.
It is kind of crazy. And you know what? I actually know somebody that got admitted, like he's our age.
Really?
Did a really hard workout. I think, you know how everyone does like the Murphy workout?
Yeah. The Murph.
And it was something like he did that, or it was like, I don't know, a big CrossFit type workout. And like same thing, got like almost like flu-like aches, ended up going in to get checked and was in the ICU for like 3 days.
That's so scary.
I know.
See, it's all these things that you don't even know. I didn't know anything about rhabdo until I became a nurse. I didn't even know it could possibly be a thing.
Me either. We haven't talked about this one. A BNP of 122,000.
Whoa. We are not breathing well.
So a BNP stands for
something natriuretic peptide.
Yeah. So a lot of times like with congestive heart failure patients or people who have like buildup of fluid around their lungs, they're not breathing well. The BNP is elevated.
Yep.
So how we expel that extra fluid is we usually give like a diuretic like Lasix. So we diurese them. We get the fluid off. The BNP then should start to come down. But like I thought a BNP of like 4,000 was high.
That's insane.
122,000.
I've never heard of one like that.
122.
And that person, these people are extremely short of breath, even with a BNP of 4,000.
They're either on BiPAP to try and push some of that out, or I don't know what you do with 122.
Also, these are the patients too where you can like squeeze on their legs and your literal handprints are in their legs because they're so edematous that when you squeeze on that, your imprint just stays with them.
Yeah.
Because it's just all fluid.
Yeah.
It's terrible.
Some women get that really bad when they're pregnant. Like the pitting edema. I didn't get that on my legs.
I didn't either. Well, I did not on my legs. I would get it. I had Indy in July and boy, was that hot. So I would have it on my feet. Like when I got home from like an all day thing and was wearing sandals, I'd like put up my feet and Nick was like, oh my God, Fiona from Shrek. I was like, listen here, asshole, I'm doing my best. But it was crazy. Okay. Some of these stories bring us to the whisper line.
The whisper line. Are you guys loving the whisper line?
We started this, last Sunday?
Yeah. Well, we started telling everybody about it on last episode.
Okay.
And so every Sunday, if you guys didn't catch, on the ER Edit Instagram page, we're starting to post the whisper line. And it's literally a place for you guys, anyone to come, just kind of anonymously tell us a secret, a story, something funny. It doesn't have to be healthcare hospital related. It can literally be anything. And then every once in a while, we're going to read some of these anonymously on the podcast.
Yeah, completely anonymous, just so we're clear. But everybody has a secret. You know what I mean? Everybody has a story to tell
and
that they've been hanging on to.
Sometimes you just want to get it off your chest. Yeah. So we thought, what better place than the ER Edit?
This says, I, a CNA at the time, once watched a lady die in the ICU because the RT forgot to turn her vent back on. I have a couple questions regarding this one.
Uh-oh.
Why didn't you say something?
well, maybe.
Did we not know?
Maybe they didn't know. Like, well, think about it. Like, even as a nurse, I'm not totally sure like how the vent works all the time.
Oh my God. I hope I don't.
So if you're a CNA, I imagine like maybe you're not super familiar with everything. So maybe like something was going on, you weren't sure.
Yeah.
And then maybe like after the fact, you had like watched everything and then realized.
And I think that that's probably what happened.
Yeah, that would be my guess. I did, in fact, put an IV in someone's artery fresh out of nursing school.
Baby
Hey,
girl.
it happened.
We all have.
It happened.
We have all gotten an artery. Those you know right away too. I'm like, fuck, I'm in the artery.
Oh yeah, those things come with a pulse.
Oh. I'm not religious at all, but the church keeps me fed. I'm a 19-year-old economics student that lives in the dorm. I don't know how to cook. I've never cooked. And honestly, I can't really afford it. But the church down the street does dinners every single night for the college kids. Most of them are religious. I'm not at all. And honestly, never gonna be. But I do enjoy the food.
Hey, you're resourceful. And Jesus wants you to eat.
Listen, absolutely.
Oh, this one's good.
Did you get a spicy one?
This one's good. This one's kind of long.
Okay, I'm ready.
So bear
That's
with
okay. I'm
me.
sad.
My 75-year-old father had a massive stroke. They saved his life in the hospital. Everyone is grateful and talks about how lucky he is to not have died. Not me. The left side of his body is completely paralyzed. He will never walk again. He cannot bathe himself. He cannot go to the bathroom himself. He can barely eat or speak. He will never do what he used to, but his mind, still sharp, still there. He's trapped in a body that failed him. I love my father, I do, but seeing him in this state, knowing that he will likely never be who he was again, I can't bear it, and neither can he. You can see it in his eyes that he doesn't want to live the rest of his life strapped in a wheelchair because he can no longer support himself, or needing to wear a bib because food falls out of the left side of his mouth when he eats. He's so sad. My mom and his siblings and friends are all so grateful he's alive. I wish he died. Oh, that gave me goosebumps.
That made me a little bit emotional, to be honest, because I agree with her.
I feel like that is something like that probably felt really hard to type out, but
it's your dad.
So valid.
Yeah.
Like so valid seeing somebody in that state, especially somebody who
we see
had a full like able-bodied life to go from that to this.
And we see this so much in the ER where people try and keep someone alive. I think because it makes them feel good. That's still their person and they're still here. And I totally understand that side of it too. But Nick and I have had these conversations, as I'm sure you and Ryan have too. And if I'm not able to live the quality of life that I was living prior to an event or whatever happens, I don't want that, because these patients sometimes are literally stuck and their only form of communication is blinking at you. And it feels like so tragic.
And recovery is not an option.
Right.
It's like therapy, maybe slowly gaining back a little bit of like skill, like feeding yourself or something. But full recovery is like not an option. That is a sad life. And I don't know, it's never anybody's like job to put a value on someone's life. You know what I mean?
Right.
But I think in this scenario, like knowing her dad lost the spark in his eye, you know.
I honestly think that sometimes is the true form of like truly loving somebody, is being able to look at them and say your quality of life at this point is horrific and you wouldn't have wanted that.
Yeah.
That's a hard one.
That is hard. You know, my dad died 2 days before I was born.
Yeah.
He had an accident. He was a roofer and he slipped and fell, and he hit his head on the way down. He ended up drowning in Lake Union in Seattle.
I hate when you tell this story. It just like gives me chills every time.
And my mom went into labor.
Right.
And so I was born 2 days later. And my mom has shared with me that my dad was young. He was only 25 when he died. And he was a very, you know, he was the high school quarterback. Like he was a very strong, like healthy guy.
Stud.
And he had shared with my mom at some point in their life, in their marriage, that he would never want to live this life if he couldn't live it to his full like potential. And they ended up doing like search and rescue and finding his body in the water. And had he not hit his head, they found this like block, I guess, of wood or something. He hit his head on the gutter on the way down, and then he hit his head again underwater. And that's what kept him unconscious to the point where he ended up drowning. And my mom had shared with me, like, if he had survived that, but had like anoxic brain injury or come out where he was not able to care for himself or walk or talk or whatever it is. She said in some way she feels like he was being like looked out for because he had made it very clear like he didn't want to live his life like that.
Was that ever looked at though? Like, do they think that your dad would have had a pretty significant like traumatic brain injury at that point based on, I mean, it sounds like he would have.
Well, it took them a long time to find his body.
I mean, so he would have been anoxic anyway, but I'm saying like, had he just hit his head on the gutter on the way down and was able to get himself out of the water, do you think that there would have been enough trauma that there would have been?
I don't know.
Okay.
I mean, I don't know. And to be honest, like such little pieces have been shared with me.
Right.
I don't know a lot of like the details of like the accident and that like what you're saying, like time and everything. So I don't know that.
I always feel like there is something or someone, whatever anybody chooses to believe in, like just kind of looking out for you at the end of the day.
Yeah.
You know what I mean?
Yeah.
And so I feel like if your dad had shared this.
And my dad was a very religious man.
Yeah, I just feel like there's more to it. I feel like maybe someone was looking out for him and was like, you wouldn't have wanted to live like this.
Yeah.
I have to believe that in those situations and in the ones that we see at work where I'm like, there's a bigger reason here. Otherwise, I think you just like sit in it and you're like, what if? The what ifs will kill you.
Yeah. And just like this girl writing in to get that off her chest, like that's got to be such a hard thing to say because you love this person and you don't want to live your, like you want them in your life.
Yes.
But then to also see a version of them that's not them. Yeah. Devastating.
Yeah. Okay. This is juicy. Okay. Is this normal in marriage or am I making it into something? I'm trying to understand whether what I'm experiencing is actually normal in marriage because my husband insists that it is. We've been married for 13 years. This started around 5 years into our marriage when our baby was about 1 year old. He began introducing fantasies involving other men into our intimacy. The first time it happened, I gave into his fantasy, but felt extremely guilty the next day. I told him I wasn't comfortable and asked him not to bring it back up again. He agreed, but after a few days, it came back and slowly became a regular part of our intimacy. Over time, it's shifted from being about random people to people we actually know.
Men or people?
Men.
Okay.
The confusing part is that while we have good physical connection, our emotional connection has never been strong. He has also cheated on me multiple times, which has affected how I see everything now.
With men or women?
It doesn't say. At this point, I feel like I'm standing at the edge of crossing a real boundary with one of his friends. And I don't know if what my husband has normalized in our relationship would actually make this okay if I told him.
That's
Baby
hard.
girl.
Okay. When you said, I don't think this is normal, but my husband insists that it is, right
Red
there,
flag.
I've got a red flag.
Red flag.
If you're saying this isn't making me comfortable, no matter what it is in an intimate setting in your marriage, if you're saying I'm not comfortable, end of story. Like, end of story. You're not comfortable. So for the other person then to insist it's fine, it's normal, continue doing this.
No.
Not okay.
Also, if he's bringing up legitimate friends of yours into your intimacy, I'm a little concerned.
Yeah.
A lot, actually.
Male or female.
It doesn't matter.
Like that's to me crossing a line.
Well, it makes me feel like you are literally craving an intimacy with somebody else that you're bringing into the bedroom verbally. Does that make sense?
Well, yeah, but people do bring in like third parties.
Well, yes.
And people do bring in like fantasy role play. And I think that like when you have good boundaries around that, but it starts to really blur a line when it's people that you both like when you know people.
Yeah.
Because now that's just crossing a line, right?
I think you need to run.
I'm getting a lot of red flags from that. I'm sorry. I am.
I am too. And I don't like that for you. I also feel like while you're writing that, all I could think about was you deserve better.
This does not give a lot of context, but it like made my heart flutter.
Oh. Well, tell me.
I heard a girl get kidnapped and I reported it. And now I keep getting calls from a no caller ID.
Shut the hell up.
And that's it. Well, they wrote underneath, I'm very paranoid. I'm going to tell the cops because I'm super paranoid.
Is she paranoid because she's schizophrenic?
I'm just having a thought right now. If you call and report something to the police, and then they call you back for anything, will their number come up unidentified or like
that's a
unknown
great question.
number?
Like maybe they're calling her for more information still.
Yeah, because I don't know. The police have never like called me, I think, on my personal number, but I'm just thinking like maybe that's an unknown number or a blocked number.
I could see that. I like where you're headed with this.
Okay. But also like where she's headed really with this. Scary too.
Ew. And even just to hear someone get kidnapped like that.
Yeah. Like witnessing that or like thinking you witnessed that. That's scary.
I had a patient come into the ER who had a partial airway obstruction. He thought he was a goner, and honestly, so did the rest of us. He told his wife on the way out, right before we intubated him, that he had been having a decade-long affair. He ended up living.
Okay, first of all, what an ass to try and just get that off your chest on your way out.
Like, and do that to her as she's
and
literally...
have that be like her last memory.
Well, and also, imagine how scared she was watching what was going to happen to the person that she loves. You wanted out of that marriage anyway, girl.
That's your sign. And I hope that was the last day. Okay, somebody wrote in and said, I've had a few people casually tell me I'm going to die today. The first time someone who was awake, alert, not in distress told me that, and then they died later that day. I was spooked, and then I've learned to believe them.
This is real.
This is real.
Mm-hmm.
I don't know that I've ever had somebody like very, very like healthy tell me like I'm going to die, and then they die. But when people come in and they're like sick or they're like something emergency is going on and they look at you and they're like, I'm going to die or I'm dying, believe them. Like it's like they have a sixth sense.
I wonder what it is though. Like I would be very curious to talk to people that have said this and felt this before to know exactly what they were feeling. Like, do you see a light? Like, is it like the movies? Do you see a light? Are you hearing something? Like what is telling you?
Is it like giving you that feeling in your body, like something's wrong, something's really, really wrong?
They'll either say what you said, or sometimes I've had patients too that say, please don't let me die.
Yeah.
And that's also like, oh, fucking red flag. Like we are headed for big trouble here right now. But you should always believe your patients when they say that to you.
Mm-hmm.
I think we both have talked about that on our TikToks before because it is so real.
Yeah. And again, it's something that you learn though,
Mm-hmm.
because I do think in the beginning, when you're not like, when you haven't had a lot of those experiences, a lot of times those patients can be confused. Like if they're lacking oxygen, like if you need to tube them, like there's a lot of factors that can make them be like, they don't really know what they're saying. And I think like, I'm not saying I like wrote it off, but I think I didn't realize like how much like accuracy there is and how much like you really need to believe them, because I would say the few instances that that's happened, it's like right on.
And probably pretty quickly after they tell you. It doesn't take long for that to happen. I had a patient one time, a long time ago. It was Christmas Eve. Heart attack. We knew that that was happening, right? And those patients sometimes are totally fine and they just go straight to the cath lab. They get fixed up.
Yeah.
All of this stuff. Then you can have a really sick STEMI. We call them STEMIs. STEMI patient where you're like real unstable.
Yeah.
This patient, this was the only time I honestly was embarrassed for my reaction towards a patient because I felt like I just like flew straight into like a Grey's Anatomy episode and I couldn't control myself. Do you know what I mean? But this patient, we're waiting for cath lab to tell us like it's go time because you prep these STEMI patients and then you have to wait for cath lab to be ready for you. And so it's like a clock is like literally ticking right in front of you. And sometimes it's a little unnerving because you're like...
It's extremely unnerving because they come in usually. It's just absolute chaos.
Yes.
There's like people doing 10 things at once, hustling and bustling. You're like, oh my gosh, you're having a massive MI right now.
Yeah.
They're in pain. You're doing all this stuff. And then you're like, okay, they're ready. And then cath lab was like, we'll be there in 10. And you're just like, ugh.
Yeah. And you're like, come on. Like I'm watching this person literally die right in front of me kind of, but they're still talking. So this patient, I'm right on the left side of the gurney. This patient looks at me with the calmest voice and these big ass eyes and goes, tell my wife and my daughter that I love them. And when I tell you,
what did you say?
When I tell you, I screamed at the top of my lungs, no, because in that instant he coded. And I just yell out as if it was a part of fucking the pit, no, and jump on top of him and start CPR. One of our good friends looks at me and goes, what the fuck is wrong with you? But I just like,
you're overcome with emotion.
oh my gosh, it was Christmas Eve. This man cannot leave his kid and his wife right now. Like, we need to, this can't be happening. I was so embarrassed when I ended up walking out of that room for the way that I think just because that's never it's never overpowered me like that before, you know, where it was like,
it hits you.
Oh man.
It hits you. And that's okay.
He did great. He had a great outcome.
Oh, he did. Okay.
Yes.
Good.
But in that moment, I was absolutely being recorded for my debut as a nurse actress in the ER. Gosh.
Well, I have had a situation where I've witnessed like family with the patient who did not have a good outcome.
Oh.
And like the emotion that has overcome me before.
Oh, yes.
The very first time I witnessed this, I was a student in the ICU, like a student nurse. And a patient had like an accident, unexpected. I don't know if it was a cardiac event or what had happened, but then ended up like having an accident because of it. Basically was not going to survive this. And had adult children who flew in, and I was there the day that the children arrived, and I saw this like grown, like 20, 30 something year old daughter throw herself on her dad's bed and scream no and like beg him not to go. And it was the first time I'd ever witnessed something like that. Mm-hmm. I was like, when I say I was like blubbering, like,
yeah, I know. Yeah.
Like that kind of crying.
They're like, who's this person in the back?
They're like, do you need to go to the bathroom and like take a minute?
Yes.
And I was like, I was in the bathroom for like 5 minutes.
I think it's still that way. I still think I have like quite a horrific reaction with mothers and their children.
Yeah.
Because that doesn't ever go away.
That never gets easier.
No.
Never.
There is a very
so
specific sound that comes out of a grieving mother that really nobody should ever hear, ever. But it's still like, it hits something in that ER where you can even walk around after you compose yourself, but you can walk around and go in other patients' rooms and they're crying. Have you seen that before too? Mm-hmm. Because they can hear what's happening. I mean, the ER patient rooms are pretty close to each other for the most part.
Sometimes,
yeah. And you can just see the other patients crying too. It's like tragic sometimes.
Yeah, it's very tragic.
But those emotions, they just really come out sometimes.
Well, they do come out sometimes. And I know that we talk about like compartmentalizing. We're all really good at that for the most part. But I think sometimes you're just overwhelmed with emotion. You can't help it.
You just gotta let it out a little. You gotta yell no from time to time. Okay, this is the last one that we received in, and holy shit.
Oh boy.
I had a critically ill patient that was intubated and sedated in the ICU. I went into the room to find the sister of the patient having sex with the patient's husband. In the room. What would you do?
To be honest, I don't know. That's like jump scare. I would like knock and be like,
Also,
sorry.
Intubated and sedated doesn't necessarily mean that they can't hear you.
Mm-hmm. That's a great point.
What the hell?
And honestly, if you're going to have an affair, because my guess is that wasn't the first time that they
Absolutely
hooked up.
Not.
Why not just leave the hospital? Like go to your car, back to your house. Like to do it in the hospital at the bedside feels like
ew, it's so gross. It's so icky, and it's so violating for the person that was the patient. Like in front of her?
Yeah, and also like there's not really privacy. It's like you walk into the hospital room and it's just like an open room. So if anyone, the nurse, doctor, EVS, dietary, if anyone walks in, you're just like on display. Do you just not care?
Also, we've talked about this before. Disgusting. Hospitals are disgusting. And you're just open up your whole kit and caboodle to that.
When I was a new nurse, I walked into my patient's room and I did the whole like, hi, it's your nurse. Yeah. And I came in and they were not in the bed. Mm-hmm. So they were in the bathroom. And I was like, hi, it's your nurse. And I cracked the door.
Full blown. Just Pound Town.
Bent over Pound Town.
Oh, no.
And I was like, oh my gosh.
I guess you're feeling better.
And like, it's kind of like, you're not allowed to do that.
What were they there for?
I have no idea. but I was so like scarred, so scarred. I was like, I'm going to come back, but also like you need to leave.
You almost feel embarrassed, but you have nothing to be embarrassed about. But like you don't want to show your face again. Do you know what I mean?
And then you like come back later and you're like, hey,
I've seen your whole
what
thing.
was that about?
I wish that the younger me nurse, like I guess differently. Like I wish the older nurse that I am now would have been in some of these situations, like as you know what I mean? Because the things I would say now to a patient are very different than when I was like very young and naive.
Also, who needs to be having sex that much?
While you're in the hospital, this is a healing journey.
There may or may not have been like an IV pole. There was still like attached.
Oh,
like,
I'm sure. They're just getting their antibiotics and a good little afternoon delight.
Oh, couldn't it be me? Couldn't it be me?
That concludes this episode.
Thanks for joining along. But no, if you guys have more any like, as you can see, people just wrote about anything, and literally it's an open forum. It's completely anonymous. Every Sunday it's going to be on our Instagram page, so the ER edit, go follow along and write in anything, literally anything.
It doesn't even have to be your own confession. If you've heard anything around town, let us have it. This like literally brings joy to our lives. Because we're just two moms that really don't get any confessions. I mean, I get 10-year-old confessions now. Those can be juicy, but not like these.
Nah, this is the stuff this is what we want to.
This is the meat and potatoes.
This is the taters. And that concludes episode 10.
Can't believe it.
Stay tuned because you may be getting an episode from the cruise ship.
Episode 11 will be Carly and I cruising. So come back for that one and we'll see you then.
Bye.
Bye.